Hi, let's talk about the excretory pathway. In this video, we'll discuss the pathway of urine conduction from the renal papillae to the urethra. The story of urine begins at the renal papillae. These are the apices of the renal pyramids. It's at this point that all of the physiological processes of the nephron are complete, and filtrate is unambiguously urine. That urine is collected by the minor calyces, which cup the renal papillae, and transport the urine to the major calyces. There are approximately 3 to 4 minor calyces per major calyx, and approximately 2 to 3 major calyces per kidney. This proximal portion of the conductive system is all within the renal sinus, so that space that is surrounded by the parenchyma of the kidney. And the major calyces come together to form the renal pelvis, which then is conducted through the hilum of the kidney and is contiguous with the ureter. The ureter is going to then conduct the urine inferiorly through the ureteroperitoneum to the urinary bladder. These ureters are tripartite. There are 3 parts to them. The abdominal part begins at the renal pelvis, and it ends at the pelvic brim, or the actual pelvis. It is the longest part of the ureter. It is in very close association with this muscle here, which is the psoas major. Psoas major is the power flexor of the thigh. And where the ureter transitions from the abdominal part to the pelvic part at the pelvic brim is also an interesting landmark, because that is the point where the common iliac artery, which is the terminal branch of the abdominal aorta, bifurcates into the external iliac artery, which serves the lower limb, and the internal iliac artery, which serves the pelvis, pelvic viscera, as well as the perineum. That internal iliac artery is also known as the hypogastric artery, and let me just highlight that for you here. There's the external iliac, and here's the internal iliac. I mentioned that this artery is called the hypogastric artery. That's what you'll hear on your OB-GYN rounds, because when we talk about the nervous plexuses, such as the superior hypogastric and inferior hypogastric plexuses, people get confused and they always wonder what this has to do with the stomach. And the answer is absolutely nothing, but they have everything to do with this artery. The superior hypogastric plexus is found superior to the artery. The inferior hypogastric plexus is found inferior to the artery. So, et voila, that's what we're talking about when we go down that autonomic rabbit hole on you. I'd also like to take this opportunity to just acknowledge that sex is not binary. You know, when we get to this part of anatomy, we're going to see a tremendous amount of sexual polymorphism, so variation that is going to be the result of differences of sex. We're used to talking in terms of this binary language of males have this and females have this. It is a gross oversimplification, as you likely already know, or if not, will learn or at least come to understand, hopefully. But when we talk about the pelvic vasculature, and we will talk in much more granular detail about it in the reproductive sequences, you'll come to understand that the branches of the internal iliac artery are all named for their targets. And there's quite a bit of variation to be had here. In terms of what we care about, there is this lovely artery here, which is called the umbilical artery. So there's one from each internal iliac artery, or anterior division of the internal iliac artery, which is that part of it. This artery heads out laterally, and when it gets to the anterior abdominal wall, it is obliterated. It becomes the medial umbilical ligament that can then be traced up to the umbilicus, or the belly button. It would be patent in a fetus, but in an adult, there is no need to send blood out towards the umbilical cord there. What this artery does have coming off of it are superior vesical arteries, and we can see one example of that here. The superior vesical artery is one of two arteries which serve the urinary bladder, which we can see here, sandwiched between the pubic symphysis and the uterus. So the urinary bladder is intermediate there. There is a wonderful mnemonic that you'll hear in all of your reviews for the boards. Water under the bridge. And what this is describing the relationship of the ureter, which is the water here, coming down, 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 running under the bridge. And the bridge here happens to be this branch, which is the uterine artery. Here is the vaginal artery there. And so at the internal os of the cervix, we have the relationship of the ureter crossing underneath the uterine artery. That is the water, ureter, running under the bridge, uterine artery. Now, there will be inferior vesical arteries that may branch either from the uterine artery here, the vaginal artery there, or as separate branches from this anterior division. In what I'll just oversimplify as males, it's most common to see this as a separate branch from the anterior division, whereas in females, this tends to be a branch of the uterine or vaginal arteries. Now, the urinary bladder is quite an interesting organ. It's extraordinarily elastic. We can see, and we will continue to see, that it is a sub or extra peritoneal organ, so it is found underneath the peritoneum. The ureters are approaching from the posterior, so those are the pelvic parts of the ureters, and they're going to communicate or be conveyed through the wall of the urinary bladder, and that's the intramural part. And they enter the bladder at the ureteric orifices, or the ureteral openings. Now, between the ureteric orifices, there is this fold of tissue called the ureteric crest, and we can see the pattern here. You know, we're humans, were evolved to find patterns. If we move from lateral to these orifices down to this internal urethral orifice, we see a nice triangle. We call this the trigon of the bladder. You might encounter the bladder in its expanded state or in its relaxed state. Relaxed, it's probably the size of a walnut. Expanded, you know, it may be the size of a grapefruit or even beyond. So this can expand out of the pelvic cavity into the abdominal cavity. It is largely comprised of a smooth muscle wall, and the smooth muscle of the wall of the bladder is called the detrusor muscle. So that detrusor muscle is served with blood from those superior and inferior vesical arteries, from the inferior iliac artery, internal iliac artery, or hypogastric artery. And because this is smooth muscle, we know that it's not under somatic control. It is under autonomic control. And the autonomics that control the bladder, or the detrusor muscle, are called the vesical plexuses. There's going to be one on either side of the pelvis. The inferior hypogastric plexus is going to run along the lateral wall of the pelvis, lateral to the pelvic viscera, and it is going to be served by sympathetics and parasympathetics. So this would be the inferior hypogastric plexus. There's also a superior hypogastric plexus that is found at the bifurcation, just inferior to the bifurcation of the common iliac arteries. And then there are condensations of fibers that travel, and they've been cut here, but they have continuity between these two plexuses. So these are mixed autonomic plexuses in bidirectional communication with one another. The superior hypogastric plexus is going to be receiving a lot of fibers from that intermesenteric plexus from above and from the inferior hypogastric plexus below. The inferior hypogastric plexus will receive fibers from the superior hypogastric plexus, but it will also receive both sympathetic and parasympathetic fibers from sources within the pelvis. And let's look at those now. So let me pick a neutral color. So here we have the ventral primary ramus of S1, the ventral primary ramus of S2, of S3, and S4. So these are VPRs of sacral nerves. That will give us some orientation, and I'm going to go to orange here for our sympathetics. In association with S1, I can see a nice ganglion there. S2, there is a ganglion there. S3, there is a ganglion there, and I don't see the ganglion for S4, but I assure you that it's probably in this area, and you're probably going down to a ganglion impar there. And so we have fibers from this sympathetic trunk running down like so. So that's the sacral sympathetic trunk. And coming off of these ganglia, and generally it's from the S1 and S2 ganglia. We've got one there, and here I can see one from an S3 going down there. These are sacral splanchnic nerves. So these are sympathetic fibers from the sacral ganglia that are feeding into the inferior hypogastric plexus. Now we also have, coming off of the ventral primary rami of S2, S3, and S4, here, let me erase some of that. Oops. There's from S2, and there is from S3, and there is from S4, and we might even be able to count that one. These are pelvic splanchnic nerves. So pelvic splanchnic nerves are parasympathetic fibers that are inputting into the inferior hypogastric plexus. So when we discuss what is contributing fibers to that inferior hypogastric plexus, from the parasympathetic side of things, we have the pelvic splanchnic nerves. From the sympathetic side of things, we have the sacral splanchnic nerves. And then from the superior hypogastric plexus, we have the hypogastric nerve. And we'll have a hypogastric nerve on each side. So this is the autonomics of the pelvis in a nutshell, and we'll revisit this when we discuss reproduction. Now there is a point to all of this. So lateral to the urinary bladder, which we have here, is that vesical plexus on the left side, and there will be a vesical plexus on the right side that will meet each other along the midline. And this is going to regulate the function of the urinary bladder. Within the detrusor muscle, there are special baroreceptors, so stretch receptors, that whenever the volume reaches a critical capacity, usually around 300 to 400 milliliters, these are activated. And this information is sent back up to the sacral spine and beyond, and through parasympathetic fibers, so those pelvic splanchnic fibers, the detrusor muscle contracts. In concert with this, there's going to be a sympathetic response, which is the relaxation of the internal urethral sphincter, which is going to be there. So detrusor muscle is contracting. Internal urethral sphincter is relaxing, so urine is being conducted distally along that excretory pathway. And the only thing that's really stopping it is the external urethral sphincter. That external urethral sphincter in children usually older than 2 to 3 years of age, or adults without any neuropathology, is going to be well under the control of the somatic nervous system, and one can decide when to relax that. It's not under a reflex, it's not part of the micturition reflex, but we all have experienced that feeling of needing to micturate or urinate, and that feeling is when you're making a conscious control to hold back the urine that the micturition reflex is telling you to let go of. So the urinary bladder, in a nutshell, we're looking at it in a sagittal view here, is a subperitoneal or extraperitoneal, so it's below the peritoneum there. It's also, the peritoneum is draped over the uterus there and the rectum there. There's a couple of surfaces. So there's an anterior surface that is in close association with the pubic symphysis. There is a superior surface which is in close association with the peritoneum. And then there is a base or a fundus. That is where the ureters are going to enter. That is in close association with the vagina, if present. And then where some of these surfaces meet, where the anterior and superior surface meets, is the apex of the bladder. And where the anterior surface and the fundus of the bladder meet is the internal urethral meatus. That's the area. The meatus is the tube that is surrounded by the internal urethral sphincter, which is smooth muscle. So again, sex is contiguous. It is not binary. Should a vagina be present, that vagina has a posterior relationship to the base of the bladder. The urethra, which extends from the internal urethral meatus there at the neck of the bladder, is going to be approximately 4 to 5 centimeters in length, and it is going to have its external meatus intermediate between the glans clitoris and the opening of the vagina, or the vaginal orifice. And so this will be within the vestibule of the vagina. That is that space between the labia minora. If a prostate and penis are present, the urethra is exceedingly more complex. So the urinary bladder will sit atop the prostate gland, which we can see there, and the urethra actually travels through the prostate gland. The urethra in males has a dual duty. It conducts both urine as well as ejaculate, and it receives its ejaculate at this part of the urethra. So there are ejaculatory ducts that are going to conduct secretions from the seminal vesicles, as well as semen from the testes into the prostatic part of the urethra. So this first part is the prostatic part. When we look at the urethra superiorly here, so there is a ureteric orifice, there's another ureteric orifice, there's the crest. Here is the internal urethral meatus. We can see, let me outline this for you. We can see that there is a little bit of an invagination, and that is called the uvula of the bladder. So that's from the posterior. That invagination is from the growth of the middle lobe of the prostate gland. So once we go beyond this prostatic part of the urethra, we come to the shortest part of the urethra, which is right there as it's being conveyed through the urogenital diaphragm. So that's a fibromuscular membrane there that's supporting a lot of the pelvic viscera. And that's called the membranous part of the urethra. And then there is the largest part of the urethra, which is conducted through erectile tissue called the corpus spongiosum. And this is called the spongy part, or the penile part of the urethra. And its external urethral opening is at the distal ventral surface of the glans penis, which is located right there. So it tends to, in males, the urethra tends to be, 15 to possibly even 18 inches in the length, depending on the circumstances. So much longer than in females. So we've discussed the excretory pathway of urine from the very beginnings, the proximal portions of the conductive system, from the renal papillae through the minor calyces, through the major calyces, the renal pelvis, the abdominal part of the ureters, the pelvic parts of the ureters, the intramural parts of the ureters, the urinary bladders. We've discussed the blood supplies and the innervations of the urinary bladders, as well as the urethrae and the pathways that the urethra is capable of taking. This is your summary slide. I thank you for your time.